WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. We Should Know is on the air. I want to thank you for being with us today. My name is J.W. Simmons. We're coming to you from Star Communications, Channel 16 on the visual side. If you're listening to us on radio, you're listening to us on WCLN Radio out of Clinton, North Carolina. I want to thank you for all your comments and also your continued suggestions that you're sending us to weshouldknowedu@gmail.com, weshouldknowedu@gmail.com, particularly on our last shows and your suggestions about upcoming shows. Today we're talking about something very near and dear to a lot of folks' heart and something that a lot of folks unfortunately have probably experienced, and our prayers go out to those folks. And then we're talking about suicide. It's National Suicide Recovery Month, and recognition of suicide is paramount on our mind. We have two individuals with us that is very well versed on that, and I'll start with Amy Drozda. And I've got that name correct, Amy. I had to practice the Drozda. I was putting an S where the Z was. Okay. So Amy, you got a master's degree in social work since 2005. Been practicing in that particular field for 19 years. You worked in Kansas, New Mexico, North Carolina 7 years now. Right. And you're a multi-systemic therapist supervisor. And program manager. Right. LaKisha, welcome back.
How
You've been with us before on the radio side. We were talking before we went on air about 3 or 4 years ago. And LaKisha, you're a licensed clinical substance abuse specialist, associate, and you have bachelor's in criminal justice from the University of Mount Olive, master's degree in social work from the University of Southern California, supervisor for Easterseals mobile crisis, with extensive experience working with mental health in the mental health field with various facets for over 15 years. Combined here, we're looking well over 30 years of experience in working with a lot of these issues we're going to be talking about today. Ladies, I want to open this with this kind of observation. When we look at the governor's declaration declaring this as Suicide Prevention Awareness Month, when we look at the data from the World Health Organization, when we look at data from the CDC, when it comes to the climatic reality of suicide exploding in a family and the fracturing that occurs throughout the community, this is indeed a serious issue that deserves more than 2 or 3 minutes talking about. Let me open with a question. What are some of the things that as this kind of comes together, this conversation, what is that thing that drove you to get into this field? And I'll start with you, Amy. I'll call it this field of trauma. Right. I mean, every day it's something different with you guys, is it not?
It definitely is, and that's one of the interesting factors that drove me. It's nice to get to hear people's life stories, going into people's homes in the community, seeing how they live, seeing how their life stories have unraveled, learning about their own particular mental illness, life circumstances, social struggles, relationships, their interactions. It's just very interesting to get to see those details, and people allow you into their homes, into their lives, and share their deepest secrets. And they're there to get the help and the support that they need. So it's very interesting.
LaKisha, I want to kind of get your sense. You obviously had a reason to dedicate your life and your academic career in this field. Was there a moment in time you said, look, this is just what I want to do, or is it just something that's kind of unfolded for you?
I think it unfolded over time, because initially I thought I was going to be a teacher, and then an opportunity fell into my lap, and when I got into this field, I was like, this is where I need to be. This is what I was meant to do, and this is what I'm going to do. Because I want to, if I can do anything to help somebody recover or be that bridge to help them get stabilized, because a lot of people, especially in this mental health and substance abuse population, both adults and children, they don't have anybody. And by the time they get to Amy and myself, they have burnt every bridge in the community and within their family. So in most cases, we're all that they have, and they depend on us. So if I can help anybody just reach some level of stabilization, then I've done my part.
The subject we're talking about today kind of deals with that sense of what you just alluded to, LaKisha, is that kind of last resort kind of thing. And LaKisha, I know I want to kind of come back to you with and follow up on your comment. I know you do a lot of the crisis intervention team training for law enforcement and those kinds of things. When we look at those kinds of training programs, it seems to me the public as a whole, there's a lot of facets that they don't understand, and when it comes to that kind of training, a lot of people look at me that they had no idea that law enforcement gets that kind of training.
Yes.
But you're involved in that. Tell us how important that is for you in your job in responding to these critical instances, and also having those folks to kind of support you and back you up and understand what you're doing.
It can, to me, it's extremely important. When working with law enforcement, they are trained to go into a situation and de-escalate it. But sometimes if they're not careful and they don't understand who they're dealing with, if they don't have some type of background training that you have to take a different approach, that they can actually unintentionally escalate the situation. So it's very important that they have the tools that they need. And then too, because my staff as well, we need to also, because what we do, we're not allowed to do anything physical. So, and we're not allowed to have any type of weapons. So we're all going out there vulnerable trying to help someone. So it's very important that law enforcement, anybody, not just law enforcement, because we also train EMS. We work with everybody so that they can have an understanding that this might be a serious situation, or we might have to take a different approach. And because if not, a lot of people will end up in jail, and that's not where they need to be when they need to go to the hospital. So if law enforcement, EMS, if first responders don't have the tools that they need, then you're going to have a lot of people in places where they don't need to be, and they will not get the help that they need.
Are you finding that more and more law enforcement agencies are taking advantage of that training and getting involved in that and growing it within their department? I
think what we have seen is that we've seen an increase, not just with law enforcement, but EMS workers, communications. Everybody is wanting to do their part, and then once they get in and get trained, they spread the word. And a lot of law enforcement officers that are seasoned officers, they say that they wish that they had had this training in the beginning of their career, because one is just a great tool to have, and then two, when you're dealing with the person that's suffering from mental illness, it doesn't matter what they think is happening. What matters is it doesn't matter what is happening. What matters is what they think is happening. And if you don't understand that going into the situation, then you're not going to help that person. You can't meet them where they're at, and you can't help them get the assistance that they need. So what we have seen is we've gotten a lot more calls from law enforcement officers saying, hey, I'm here, I think this person can benefit from you guys' services, can you come out, can you send somebody? And we definitely will send somebody out. So rather that person going to jail and getting criminal charges, they're able to get the mental health treatment that they need. And
clearly I think that's on I guess the screen of news media now every day. We're seeing more and more about the need for those kinds of things. And I wanted to kind of point out in that question that you guys not only were doing that, but we do have some agencies right here in our area that's completed that course, every officer in there. And I hesitate to mention this, but I believe the Clinton Police Department is one of those agencies. So
yes, and
I say that with some sense of pride. You know.
Right. Yes, we have a real good relationship with Clinton City Police Department. They've even offered, they're one of the first departments that have offered to allow us to be able to go in there anytime, day or night, to be able to provide mobile crisis services, because we are community based. We come to you, you don't come to us, and our staff need to be able to feel safe in doing their job, and a lot of people don't want us to come to their homes. So that is a great relationship and partnership, and we have done a lot together over the last couple of years in the community.
And before we get off that subject too, if somebody's interested in that, or if there's a person listening that maybe is in the field of emergency response, they want to know more about that, they want to engage that for their department, do they call you? Can you give them a number? Or
they can, if anyone is interested in doing the crisis intervention training, all they need to do is go through East Point, that's the managed care organization, and if they're in this area, they can contact Melissa Reese. She is the community relations specialist that will help set that up, and once you contact her, you can call East Point, and they'll be able to get that scheduled.
Okay. Amy, you finding the same situation with the areas you're working in, that need is there and that it's being fulfilled, or is there a gap where we need to do more training in that area?
I would say the need is going to be anywhere. So definitely Sampson, Duplin counties, I think they struggle the most with the limited resources. But I would say any county, any state throughout the United States, the need to have the training to be prepared, to be aware of mental illness and how that affects people's behaviors, especially when they're in crisis situations. So.
I think one of the things you allude to, LaKisha, that is important is for folks when they hear us talking about this, I think all of us at this table understand that we're not asking people out there to be psychologists or psychiatrists, but we're just saying that if you need that intervention, it is available here in North Carolina. And if there's one thing I'd like for somebody in the big media, I'm little media, but in the big media, to stand up, so maybe some of our politicians, and say how proud, so I certainly am, that we have those resources and that we have the experts in the field like you guys and your associates that are willing to step up and do that. And that particular observation has just been somehow missed on the media. I mean, we're looking at the wrong thing on our windshield sometime, and I think we need to look at that. We're going to go to break in about 10-15 seconds now, so as we do that, I want to kind of prepare folks. When we come back, we're going to kind of step into that world of suicide. I want to kind of talk about it from your eyes out, what you see, help us understand what we need to do. So ladies and gentlemen, if you will, stay tuned. We'll be back in a moment. We're talking about suicide awareness, prevention. It is September and it's that month.
Experiencing slow internet? If you have a fast internet package, the problem is most likely your wireless router. With more devices using Wi-Fi, your wireless router may not be able to deliver the speed and coverage you need. We now have the leading solution to enhance your internet experience. Using small devices in a mesh network, these Wi-Fi appliances cover just about any size home so that all your devices can operate to their fullest potential. Whole home Wi-Fi from Star Communications. Get the most out of your internet connection.
Ladies and gentlemen, We Should Know is on the air. My name is J.W. Simmons. I want to welcome you back. We're in our second segment of the show today. If you're listening to us on WCLN Radio, we appreciate you doing that each and every week. We're coming to you on Star Communications, Channel 16, Tuesdays, every Tuesday at 2:30. Actually, we're a little beyond our 10 years of doing this now. Also, if you're happening to think, well, I might miss that 2:30 thing, then 7 p.m. Tuesday, Thursday, the show comes on again on Channel 16. It's also uploaded to YouTube. We look forward to seeing you again on these many social media platforms as we can get on. We feel like our information and the people we have will maybe not only, I guess, improve your life. In this situation, you could help save your life or somebody else's. We're talking about suicide. We're talking about this with two people that have experience, well over 15 years each, specialty degrees, graduate credentials, all the kinds of stuff that folks need to know about. Amy Drozda and LaKisha King. LaKisha, you're an old friend here, been on before. Amy, I want to welcome you today and also welcome you back anytime. When we went to the break, a lot of our listeners or viewers probably know this, but when we're on break, a lot of times we talk about as much stuff on break as we do on the air, especially in these kinds of topics. But with suicide, the big thing that a lot of folks, I think, say to me, and a lot of messaging I get when they know that we're going to have a certain show on the air, but a lot of it over time has been, how do we discern suicide? How do we identify it? How do we understand and recognize it? And then more importantly, how do we respond to that? Either on a family level, a friend level. Different organizations, you know, the research I've done just draws out organizations, military, the data. When I look at a lot of the data now, a lot of younger people, you would never imagine, you know, I couldn't imagine that. Do I now recall people when I was young that committed suicide? Absolutely. Was it traumatic? Absolutely. Could I have prevented it? I don't know. So that's where I want to go. Okay. Let's talk about that and what your experience has been and what you would recommend for folks to do and for what to look for. When do they act? Because I don't want everybody to just panic. You know, somebody says, well, I've got an upset stomach and I don't like chocolate milk anymore, and panic and think that's a sign or something. So let's...
Okay, and I'll speak to those,
Sure.
The risk factors. What can you notice? What do you see whenever someone may be contemplating suicide? So obviously depression is huge in the United States. Only about 50% of people that experience depression seek out any type of help. So the type of depressive symptoms to look for would be feeling sad, emotional, more withdrawn than usual, kind of wanting to keep to themselves, not wanting to be bothered. Kids that are kind of holing up in their bedrooms, not the normal teenage stuff where they just want to have their independence, but just they are not like themselves. They're not interested in things they used to be interested in. And I think a good indication of that for kids is when they have friends that they've been close to and you see that they're no longer wanting to go spend time with those friends. They're not active in the activities they used to be, you know, active in or interested in. But even adults, you know, they are more isolated, less apt to go out, to do things, to have fun. Also the hopelessness, feeling like things are just never going to get better. They may make comments such as, you know, life's not really worth it. I don't even know why we're here. Those types of comments are good indications. Whenever they make statements such as, nobody would miss me if I was gone. The world would be better off without me. What's the purpose? And then the self-esteem issues that a lot of people face, as far as I'm not worthy of good things. I haven't done anything with my life. You know, not feeling satisfied. And then you've also got the more extensive risk factors such as extreme physical pain, people that have ongoing physical health conditions that continue to worsen over time, terminal illnesses. You've got veterans, you've got trauma, you've got physical abuse, sexual abuse, all those different situations that make you question your life, question what you're doing, wonder if you've lost your functioning. I think one of the reasons, I'll throw out a couple of statistics, men, once they reach the age of 50, and especially once they've reached the age of 75, are at a higher risk of suicide. And I think a lot of that is because men are considered the breadwinners. They're the ones that, you know, they do the physical tasks in a family, and over time and over age, some of those decompensations make them feel less worthy, make them feel like they're not able to support or be depended on like they used to. So age 75 for men is a huge increase. And then elderly in general, and an interesting fact is 1 in 4 elderlies that attempt suicide are actually successful. And that compares to society in general, where only 1 in 25 are successful if they attempt it. So the elderly population is definitely a focus area to put some attention to. And then the higher risk for kids is 15 to 24 is a high risk factor, and then women ages 45 to 54 are the highest risk factor for that age population. Lesbian, gay, bisexual kids are 3 times more likely to try to commit suicide than straight children or straight adults. And then again, back to the factor of men being a high risk area, 79% of men that attempt suicide are successful because they're more likely to use lethal means such as guns, something that is going to get the job done, whereas women, they attempt suicide 3 times more than men, but they typically are using things such as overdosing on pills, which is less successful. A lot of times you can be recovered.
LaKisha, one of the things I'm listening to Amy with this information is kind of traumatizing just to hear it in a way, but are we too dismissive of it? Do we hear do we hear what Amy's saying? But at the same time, we probably, folks that are listening probably are thinking, well, I know so-and-so that just occurred, or something just happened, or I remember a certain person, and they're visualizing it. And unfortunately, there are people that are listening that have had this happen in their near family. Do we kind of look at those things, even knowing it, and think, well, I really don't want to pick up that phone and call for help because I'm opening the door to too much personal, especially if it's in your family. I mean, is that really something that people deal with, wrestle with that?
I think sometimes. What I'm starting to see now, especially since I've been doing mobile crisis, we get a lot more calls now of people calling out of concern. So one of the things we push, one of the things that we voice to the community is if someone says it, you can't run the risk. Because a lot of times people will dismiss like, oh, I know Amy, she's not gonna kill herself. She would never do that. Right. But then you hear months later that she made an attempt, and then you go like, because I think a lot of times it's our perception of an individual can stop us because of who we think they are. We think that they're strong. We think that they're okay, and realistically they're not, because they don't always verbalize how the losses that they're having, or the struggles that's going on in their life, or the physical pain that they're enduring. Everybody is not open to share that information, so at times we can become dismissive of that person because of our perception of that individual or family. One of the things that Amy, when she was talking, one of the things too, another risk factor is a family history. If there's a family history of suicide attempts, then that makes that individual more likely to try. And
so there is a gene relation thing going on. Really?
Yeah, so if there's a family history, because we get, like I said, I've got dispatches where someone have identified that, maybe their father or grandfather had committed suicide, and that's what they were contemplating. And so once we get out there and assess them, we pull back and get deeper. It could be some depression things going on. It can be genetics. It can be a combination of things that's happening in that person's life. But one of the things we want to make sure that we do is, I just tell everybody, if somebody says it, don't run the risk. Don't play with the risk. Don't dismiss the fact that they may or may not, because you do not know. So I would urge you to call somebody. Call 911. Call 211. 211 is the information in the United States, and they can link you to wherever you need to get to. If it's the suicide hotline, if it's to call mobile crisis, or if it needs to call the managed care organization, they can definitely get you connected to the right people. You would rather err on the side of caution than to not do anything at all and then find out that this person was successful in committing suicide.
And I'd like to add just for a second. So as far as the genetic tendencies, that would be more likely related to depression. So depression is a biochemical state. So that can be carried on in genetics, and it might be more highly likely in certain families. But as far as actually attempting suicide, I think that the likelihood of it happening with various family members is the fact that they don't have the skills necessary to manage stress, manage conflict appropriately, and they look to suicide as the answer instead of using various skills that could help them cope better with the problem.
Going to an extreme measure.
Right. And then also, there's been those different stories about kids that have committed suicide, and then it kind of takes its own as far as other kids committing suicide. So actually the media and publicization of suicide with teenagers can actually encourage other teenagers to use that because of all the attention that they get when they do commit suicide. It's kind of like they get their little moment of fame, and the other kids that are feeling maybe not as noticed, think of that as an option just to be noticed.
I think this is one of those points that I'd like to kind of maybe get this question in too. When parents or whomever's listening to this, we're dealing with a lot of issues, especially school counselors. We've heard a lot of conversation about bullying and cyberbullying and all that kind of thing. I know that builds into it, and I know that has I'm not going to say a huge amount, I'm sure it has some impact, but I'd like to get from you guys a sense of what all that means when we hear bullying or cyberbullying? Because you mentioned a while ago, Amy, that oftentimes children disappear, and most of the time I've noticed now with my grandchildren that are teenagers, they've got a cell phone in their hand. They disappear there on that
Right.
medium. So when we come back, I'd like to talk about that a bit on our next segment.
Okay.
Ladies and gentlemen, we'll be back in a moment.
You come out to replace a bad sensor, and that adds a 5-year commitment to my contract, and you don't tell me? Here's your sign.
Switch to the sign that's keeping homes secure and customers happy all over the area. Security from Star Communications. We pride ourselves on fair pricing and quick, friendly service every time.
Somebody trying to break into this place?
Security from Star Communications.
Ladies and gentlemen, welcome back. We Should Know is on the air. J.W. Simmons here, your host, and today we're talking with LaKisha King, and we're talking with Amy Drozda, and we're talking about suicide. Ladies, not a conversation that we like to have. Unfortunately, it's a conversation we need to have, and we're talking about the particulars. When we went to break, we kind of broke with the idea that the bullying issue that we see in schools oftentimes, especially we're dealing with young people, both in the kind of the past world, we didn't have social media. So it was just, the bully was there and we knew who the bully was, and the kids kind of stayed away from that person because they didn't want to get pushed or shamed. But now we have something called social media. Let's talk about those dynamics. And what are you seeing in that? And is it something that is escalating? Do we see more and more social media bullying that lends itself to that extreme of suicide? And how do we face that? What are some of the recognition signs in that area? Either one of you or both of you.
I can speak to that. With social media, the kids even adults, they crave those likes, the shares.
Yeah.
And so it definitely, if you post something negative, mean, an ugly picture of somebody or just a normal picture of somebody, and then you're making negative comments about it, and then people start to laugh, the smiley face, the laughy face, the likes, the shares. And then the person that's being bullied sees that, because most often they're friends on social media, even though they're technically not getting along. Because the more friends you have, the more, I guess, accepted or popular you feel. And I've seen where kids are getting bullied on social media, and instead of deleting that person as a friend so you don't have to see those comments, they are almost like obsessed with looking at it to see how many people have seen it. And then the comments, they may comment themselves on something that somebody has said, trying to maybe defend themselves, or, worst case scenario, retaliating and saying negative things about that person as well. But they keep that going. They give them the response that they're looking for. And parents, they continue to allow the kids to see those posts and to keep those people as friends and not to restrict that social media access. So that's definitely been a problem I've seen. Parents that know their kids being bullied and know that it's being bullied by specific people, and allow their kids to remain on social media or to remain friends with those bullies.
And that could be, LaKisha, that could be thousands or so people that can be slamming this person.
You're talking about millions. Because
Yeah.
anytime you post
unlimited.
it on social media, once it's posted, even after you delete something, it's never gone. So people need to, and then you have to understand that these kids are just not on Instagram and Facebook. They're on Snapchat, and then there's every day there's TikTok, and it's everywhere. So TikTok, I think, was probably one of the more frequent ones that I've noticed, where, because little kids get up there and post videos. For example, I know of a family friend whose daughter, she posted a TikTok video just having fun, and a kid came up there picking on her. And thankfully, the child didn't understand her because she can't read. She's only 5, and she was just up there having fun. And she had her own little account, but other kids were coming in picking on her. So the parent intervened and stopped that. So I think that as parents, for your teenage child, you need to intervene and do something like Amy said. You need to restrict the access. You can report it to the social media platforms to stop it. We have to protect our children and each other as much as we possibly can, because once it's on social media, the entire world gets to see it. Then you have, versus like when we were coming to school, you just had to deal with it in school. So it was like a controlled number of people, versus when you post it on social media, the entire world has to get a say so. And so you have to fight the world versus it's fighting one or two people. That's a lot to take on.
And if it deals with relationships, Amy, something you mentioned earlier, if it deals with relationships, that's even a harder slam for that person, because not only is the relationship now exploded, but everybody's piling in on it.
Right. And unfortunately, it sometimes goes to the extreme of sexual harassment as well, because you're in the privacy of your own bedroom, you're an adult, you're a teenager, you're a child, and you post something or you send a private message to somebody, and it may be sexually inappropriate, it may be you doing certain poses or just looking promiscuous, or it may be, partial nudes or nudes. And unfortunately, you send those to somebody, and then let's say you break up with that relationship and they no longer like you, or maybe they're angry with you, and they post that on social media, or they share that with their friends. And then that's a whole nother level. And honestly, I believe those types of situations lead to kids attempting suicide, because there's my naked body, part naked body, something I privately shared with somebody I cared about, now plastered all over social media, and you can't take it back. And there's been everybody in my high school, or everybody in my social circle has now seen this, and it creates a lot of vulnerability.
Literally, your world collapses around you, because your world now is that.
Yes.
And so as it collapses, then you feel like you have to escape. And so then the plan goes into effect, well, I have nowhere to go.
Right.
So the question then, obviously, is there a way that folks can intervene? Is how does parents, friends, or others recognize? You mentioned some of those cues a while ago, but particularly around this subject.
So I'll speak on the protective factor. So suicide is a two-sided coin. So there are the risk factors, and then there's also protective factors. And so with the protective factors, you have internal and external. The internal factors that will help a person or have them less likely to commit suicide would be, one is their ability to cope with stress. If they have positive coping skills, like Amy was talking about, because a lot of people who go to that extreme, because that is an extreme, they don't have positive coping skills. They don't know how to deal with stress and anxiety and know how to problem solve. So that's what they go, I just want it to stop, and in order for it to stop, I'd just rather just die. So if you can cope and you have good coping skills, then that is one of the internal coping factors. Another is people who have strong religious beliefs and ties. If you are involved in church, whether you're a Christian, whatever your belief is, a lot of times that right there will help you to not go to that extreme, because whatever your religious belief is, you'll hold on to that, and that will keep you pushing forward. Even if that means that, like, I might be feeling down, I'm not going to do this, so I might need to go get some help because I feel this way and I know it's not right. And I know I need to talk to somebody.
That's an important point. I want to just, because one of the things I had listed here was responsibilities of churches and faith-based organizations. And I think you just nailed it. The faith-based organizations and churches become the rock that a person sees as something they can hold to in the storm, so to speak.
Right.
Yeah, and I think a lot of folks maybe turn to churches or faith-based organizations, and if there's those people, of course our listening audience has a lot of those people in it, they also need to recognize these kinds of signs and be willing to step up. Is that a good thing to kind of say? Is that the best way to say it?
Because that adds on to the protective factors. If you have good social supports, people in the community, good social relationships. So if you're saying that a lot of people who are faith-based, they know how to reach out and say, hey, can you say a prayer for me? So when you say, can y'all pray for me, then that has your members in church, they'll start to reach out to you. They'll start to check on you, pray for you, and that helps build that positive, it basically increasing the amount of contact you have that will help you restore your strength, get you on the right path to getting the help you need, whether it's therapy or engaging in more positive activities. A lot of people exercise, so a lot of people run. If you are a runner, you are less likely to engage in negative behaviors, and because it's very therapeutic. So right now you hear people are saying open the gyms. That is their way to decompress all of the stress. So most definitely. Another one is, having that increased responsibility to others. So if you feel like you have, I can't do this to my family. I don't want to hurt my church. I don't want to hurt my job. You know, I've got to finish this. Then if you have that sense of commitment to others in the community, that will make you less likely to want to end your life. So there are protective factors that will keep a person, just like there's risk factors, there's protective factors. So if you can identify that a person has many protective factors, they have strong relationships, they have strong natural supports, they are working, they're less likely to commit suicide.
And I think along the religious lines too is certain religions believe certain things will happen to you in the afterlife if you were to commit suicide versus die of natural causes. And that can actually be one of the factors that prevents people from doing it. Because, you know, when I go out and I do assessments, you know, one of the things, if I know they've had suicidal thoughts, if I know they've had suicidal behaviors or attempts, I ask, what kept you from doing it? You know, how come you're still here talking to me now? And a lot of times that is, I didn't want this to affect my family. I didn't want this to affect my church. If I were to kill myself, my belief is that I will go to hell. You know, those types of things are what people share.
So that faith factor, as you pointed out, you know, whatever your faith belief is, becomes that point that you rely on something. So for kids that are in school, the same thing applies to older adults as well. There's not any difference in their sense of need for that. So if we're talking today and there's ministers or youth leaders out there, what should they hear from you guys as to what they need to be doing if they're not already doing it?
Well, I've spoken to a lot of ministers in the community, and people come to them and they get overwhelmed and they don't know what to do. And so at that point, it's just a conversation that I tell them. I said, hey, because at some point, some people's problems exceed going to prayer or just talking to them, and they need some more clinical help. And that's when we tell them, hey, just give us a call. Mobile Crisis is here, and we can help get that person engaged in services to help get them stabilized, because even though they are we don't want to say that they're the foundation, but they are a crucial piece of it. They can't do everything.
We're going to pick up from there. We're going to take a break, ladies and gentlemen. We'll be back in a moment. I want you to stay tuned and call a friend. We're talking about suicide, one of those subjects we don't like to hear about, but is real and right here in our communities. We'll be back in a moment.
To get the most out of your electronic devices, you need a strong internet connection and a protected home Wi-Fi network. You need high-speed internet from Star. Star has the fastest, most affordable high-speed internet service available for all your devices. We have no long-term contracts or high-pressure sales. Our service speaks for itself, and switching is hassle-free. We take care of everything with free installation from a local company. High-speed internet from Star. Internet at the speed of life.
Ladies and gentlemen, welcome back. We Should Know's on there. We're coming up on our last segment here. A lot of information today that we've tossed out to you. We know a lot of it is hard to digest in such a short period of time. We want to make sure that you have access to numbers, to contact information. East Point Behavioral Health is the 800 number, 913-6109, 800-913-6109. That's 24 hours a day, 7 days a week. They will get you somewhere. LaKisha, Amy, thank you for being here with us. You mentioned a while ago, LaKisha, 211, excellent recommendation. They can call that. They can get up with you guys. They'll channel it to Easterseals. They'll take it wherever we need to do. But when we're talking about suicide, we kind of on break kind of got into this whole subject of COVID. In May, the U.S. News and World Report had an article. This was in May. Of course, May seems like a year with COVID world, but they were talking about this impact of what's changed in the suicide world as it relates to the COVID world. If you will, let's talk about that, and you give us a real world view of what you're seeing on your windshield every day. Because again, to remind folks, 24/7, is your response? And both of you guys are supervisors, program managers, over 15 years of experience, cover multiple counties. Is this creating more problems because of COVID? Is people staying home making it less because they're not out in the public? Is it increasing that social media thing we're talking about with everything from bullying and so forth? What are you seeing?
I've seen a variety of things. I think people being stuck at home can be good and bad. I think being stuck at home can be good whenever the family members actually have more time together. You know, parents that are generally in the office working 40 hours a week now can be at home with their kids and have a lot more quality time. On the flip side, the kids can be on video games and social media a lot more often because they have all that time, because school used to take 8 to 10 hours of their day, and now it's taken, honestly, probably 6 or less, generally 1 or 2, because they cut the classes earlier, they do the online learning remotely at their own paces. And another thing I've seen is the ability to access services in the community has reduced because a lot of providers are not providing in-person services, outpatient therapy especially. The enhanced services throughout like our East Point catchment area, definitely you're required to continue. Like if you're an intensive in-home, a CST, an MST, wraparound mobile crisis, those different enhanced services are still required to go out in person to respond to crisis. However, they're not expected or required to provide their normal ongoing services in person. So the increase in telehealth and telephone, which is wonderful because a lot of people don't have transportation and it's easier to access as long as they have a cell phone or a computer device. But I think the lack of face-to-face contact to get those mental health services puts a damper on what you get out of it. Sometimes it can be super beneficial because you're not having to do the travel time. You can really concentrate and focus. But some people just do not do well without having that person-to-person contact to be able to receive that service.
LaKisha, talking about telehealth and telepsychiatry and those kinds of things, is there a normal escalation that you use telepsychiatry and then you think, well, no, I need to see the person, or do you have to take each case individually? Is there any kind of process you guys use? Or
well, for us, for mobile
work?
crisis, it's on a case by case, which means dispatch. Everything we typically do is face to face. Everything we do is face to face unless the person requests that you not come. And a lot of people do not want you to come, so they will prefer that you do telehealth. But you would be surprised, a lot of people want they want that face-to-face interaction. Like Amy said, my team, we're 24 hours, so we have not stopped. My staff are still going out and seeing people if they can face-to-face, meeting them in the community, maintaining social distances, taking all the precautionary measures to ensure their safety as well as the safety as the member, just trying to make sure that they're not impacted by COVID. But in the same token, we haven't seen an increase as far as us providing telehealth services, but we're still providing. I think it's been maybe like 2 or 3% of our dispatches, if that, because everything we're doing is face to face. So we're still out there, still seeing people. But like Amy was saying, we are getting, we have seen an increase in calls for people needing access to services because the way the world looks now in service delivery and COVID, we have to use telehealth. So a lot of people are not comfortable with that, especially the elderly. They're not tech savvy, and so they're not comfortable, or they may not know how to use a phone or how to Skype or how to do those things. So we have to take all those things into consideration.
Do you get calls where you have folks to say, well, I want you to meet me somewhere. I don't want you to come to my house or my neighborhood, or again, back to that shaming thing. And do you meet people at places?
Yes. I mean, my service line, we meet you anywhere as long as it's safe. Like I said, we're 24 hours a day. Now, anything after hours, when it goes dark, we Depending on the area, we may take law enforcement with us just to ensure the safety, but they don't always stay. But we literally meet you anywhere. We've met people in the Walmart parking lot. The only two places we cannot go into is the jails and the hospitals. We're not, the state says no, we can't go into there, but so technically, as long as you're not admitted or detained, if you have been released, then if we need to meet you in the hospital lobby, we can. But right now, you cannot go into the hospital lobby because of COVID. But we can pretty much provide services anywhere.
I think that's interesting because jails typically, LaKisha, I'm recalling here an article I read. There's an increase in suicide in jails. So how does people that are incarcerated get assistance? Or that was a good point. I didn't know that about jails. I didn't know you had.
They have a social worker. Yeah, they have a social worker that's assigned, and they may help coordinate. They do get some medications in jail, but jails and prisons are completely different. But we can't provide mobile crisis services, and we get calls, but we cannot do that. We just tell them what they can do once they're discharged. So once they're discharged or released, I've had sheriffs call me and say, hey, I got a guy here. Can y'all come see him? We just released him, and we send somebody out and get that person
And that's
stabilized.
a legal issue. Nothing that, you guys would go if you could, but you just...
It's actually a financial issue.
Financial issue, okay.
Yes, it's because the jails or the prisons have certain financial funds available to contract their own specific specialized services.
So they should already have the funds for that. Right.
And so it would be paying for the jail, you'd be paying the jail and prison to provide the services, but then paying another service to come in to provide the service. So it's a duplication of pay, which is why mobile crisis can't go into there.
Which brings on a whole nother topic and question. Maybe we can get this in this last segment as well, is the financial piece. Folks are listening to this show today, and with what you just said, obviously the question would be, well, if I call them, I don't have any money, or maybe I have Medicaid, but I'm not sure what Medicaid. In fact, if they're contemplating suicide, they're probably not. That's not going to be the main thing on their mind. So, what is the cost for you guys to respond?
For mobile crisis, the cost is free. The state of North Carolina pays for it. So regardless of whether you have insurance or not, Medicaid, no insurance or whatever, you can get mobile crisis services. There will be no out-of-pocket costs for our service. We are available 24 hours. We're in 7 counties. Sampson and Duplin County is one of them. And our number where you can contact us directly is 1-866-241-7245, and we're available 24 hours a day. Like I said, there is no out-of-pocket cost. We do not transport, and we don't provide medication management. Our goal is to get you stabilized and link you to a provider, or if someone is actively suicidal, our goal is to get you inpatient. So whether that's voluntary or involuntary, we assist with that process. So that's what it's just an assessment of what's going on with you and how we can best get you stabilized. So whether that's outpatient or inpatient, that's what we're here to do.
And I'll speak real quick on the community mental health in general. Community mental health centers have ability to take, whether you have Medicaid, no insurance at all, private insurance, any form of income or pay source can be an option. Certain agencies have to be credentialed with those insurance sources, but Medicaid, no insurance at all, can pretty much go to any community mental health center or nonprofit agency.
We've got basically 2 minutes, so I want to try to get this in a minute if I can. Something that requires 30 minutes, but I've got to ask the question. Quickly tell us the relationship of expanded substance abuse and suicide. Is there a direct correlation that we can tie to that, or is it not necessarily synonymous?
And absolutely there is. So if you notice somebody increasing their substance use, they are at a higher risk. It might be related to the hopelessness, and that actually might be like one of the risk factors or one of the things that you notice when they're becoming more depressed and they're kind of taking those risks and caring less. And on the flip side, somebody that is suicidal and uses substances is more likely to actually commit suicide because of the impulsiveness and the inhibited ability to control your emotions and your actions.
What she said.
Guys, I want to thank you for taking your time being here today. LaKisha, give us that number again for for Easterseals.
So if you are with the person and they are attempting, and they have attempted, you need to call 911. Please make sure you call 911. And then after you call 911, you can also give us a call. Our number is 1-866-241-7245. We're available 24 hours a day, 365 days a year.
Okay, ladies and gentlemen, Amy Drozda and LaKisha King, thank you again for being with us. We want to thank you for being with us today, and we look forward to seeing you each and every week on We Should Know. We're trying to bring you information that's going to hopefully improve your life. And in this case, this information will maybe not only improve your life, but save somebody's life. Use the numbers they told you about, and hopefully we'll see you again next week right here on We Should Know. And as always, we like to say to you, may God bless.
Thank you for tuning in to this week's episode of We Should Know with host JW Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.